I wanted us to take some of the next 3, 4, maybe some 10 minutes as I wind up to look at the role of mental health technologies. So we know these days that definitely technology has come closer and closer, even for us in Africa, and that mental health can be an opportunity to address the challenge of mental health care and the data itself, the data collection itself. So most of us these days, we have wearable devices that we go around with on our bodies, and some of these devices can collect some variable information. One that I use actually collects information on my stress levels during the day. So that could be a potential source of information or data. We have, these days we have telephones, they collect data. We have aspects, we have situations like online support groups. You go to Twitter, now called X, Facebook or LinkedIn. There are groups of support groups where people sit or listen in and engage. We have some digital assessment and diagnostic tools, so some sort of self-screening. So where you can go in and punch in some questions and be able to get some sort of a score. There are some gadgets that deal with the therapeutic gaming. So you engage in some games, and you should be able to maybe reduce some stress levels. We have telehealth or telemedicine and associated digital treatment programs, and some different types of apps. So by and large, technology has opened a new frontier in mental health care and data collection. And that the promise of this technology to improve mental health outcomes has not been fully realized. Yet it offers us more personalized data and services. So the question is, I think that really at the top of my mind is, how best can NGOs, governments, and different institutions, research companies tap into this data? Because this data is out there, and I don't know how best we can exploit that data. Like I mentioned, I have my own gadget on my arm now. I've not seen anybody coming to ask me for my data. And I'm not even so sure whether there is any entity somewhere that is collecting the data. Maybe if they are collecting it without my consent. So the best I can do is that I have linked my gadget to my phone, and I can be able to tell a few things to myself, maybe as some sort of a self-assessment. But not everybody has that time and interest to be able to follow up on what is happening within their bodies. So even if somebody can have this gadget and they may not be able to exploit this data. So I think that is a potential opportunity that is out there. So I think, was it Amos who was talking about why not allow us to collect the data and use it as part of this project? But I'm thinking that there is already data that is existing, even for instance, through if you are interested in technology. The question is, how best can we access this data? This graph, I found it quite interesting, that a lot of money is being invested in digital mental health. So you can see the market size in terms of US dollars in billions across the years. And then there are some projections that by the year 2032, the investment will have risen to around 72 billion US dollars, which would really be a lot of investment. So the question is, since there is an unprecedented growth in the area of digital mental health, or in this particular market, how best can we as researchers take advantage of it? So that is a question that I wanted to leave to you. And that there are opportunities there. And we can just discuss that briefly. But before we discuss that, is that when we talk about digital data, we are also looking at aspects to do with data science, and I'm sure there will be another session that will focus on what can the data science do. But I wanted to flash this picture here that data science and the related advances in artificial intelligence and machine learning and data mining, we can actually be able to do a lot, even when we have unstructured data or social media data or radio data, or whatever it is you want to call it, that is slightly different from conventional data sets. Data science ideally is very important in improving the diagnosis and transforming treatments to ensure that at the end of the day, mental health illnesses can be prevented. Because we can even use aspects like GIS, to know which people are struggling or which groups of people. So we can know how people interact. We can be able to monitor lifestyles and symptoms. We can be able to tell the early warning signs for mental health. And we can be able to know what really works by using some aspects of big data. So there are a number of opportunities that we can get from the use of big data to address mental health challenges. And we can be able to use this to create benchmarks that are able to track our progress based on the different countries. So that is basically what I wanted to discuss with you today. And I will conclude by mentioning that ideally, mental health research and data, they remain scanty in Africa. And the question that is available to us is how can we ensure that the available tools for screening and diagnosing mental health are valid and reliable for the different contexts in Africa? Because like I started saying from the area about 1 hour ago, is that what works in one community may not work in another community. The other question is how, I think somebody talked of funding. How can we improve investment in the area of generation of mental health data? The type there, mental health data generation. So we don't have really to continuously rely on external funding streams to be able to address our own challenges as Africans. So we needed to task our governments, our ministries of health, to prioritize mental health as a major issue within our different contexts. When it comes to evidence, we need to be a little bit more diverse and understand what actually works for hard to reach and vulnerable communities, as well as understand why we have prevalence of mental health challenges common among different subpopulations. We have already seen that there is evidence to say females have experienced more mental health challenges than males. And I saw a number of you urging that that is not actually what is on the ground. Maybe it's not a reality. It could be an issue of a diagnosis gap. Young adults, these days we have more young adults experiencing mental health challenges. And lastly is to understand or think critically how we can take advantage of technology that we have. Technological and digital gadgets offer promising sources of data how best can we integrate this within clinical health records and within population level behavioral surveys? So how best can we triangulate the data that we have, especially from these technological records opportunities that we have?